1. In creating an eyebrow design, what is the best approach to determine if the horizontal analytic approach? 3. Take a photo of client and view it. 2. Which one of the following is the major role of lymph fluid? Removing waste. 3. When evaluating a client's face shape for an eyebrow procedure, it is important to keep in mind that every face is asymmetric. 4. Collagen and elastin fibers are located in the reticular layer. 5. The preferred method for reducing discomfort associated with micropigmentation is topical anesthetics. 6. A scratch test should be applied to the postauricular region. 7. If a client asks prior to a procedure, "What will I look like?" the technician should discuss consequences. 8. Understanding anatomy and physiology will help the technician with all of the follow except pigment removal. 9. What are realistic expectations for micropigmentation? The color will fade over the years. 10. In selecting an anesthetic, a topical solution that includes epinephrine will minimize swelling. 11. Which of the following is true about latex? It can cause an allergic reaction. 12. Photographs provide a record of the skin's original condition and should be taken by the technician. 13. When creating an eyebrow design on the client, the practitioner should use makeup pencil. 14. Which of the following could avoid blurring and fanning? Placing pigment in the upper reticular dermis. 15. In Virginia, all licensed tattooers are required to complete a minimum of how ma of health education during their licensed term. 516. A corneal abrasion would affect what part of the body? I-17. What nerve affects sensation in the face? 5th cranial. 18. A client has had a severe bomb or tissue removal, itch causing the skin to the BGHT, hard, and without fatty tissue. This skin condition is referred to as contracture. 19. During the consultation, the chant should be made aware that touch may be required to achieve the client's desired results. 20. The only muscle in the forehead is the frontalis. 21. Colk migration most commonly occurs in which type of skin tissue? Mucocutaneous. 22. While working with clients, what is one of the most important hazards for a technician? Bloodborne pathogens. 23. A non-motorized machine is also called a manual tap. 24. Which gland produces tears in the eyes? Lacrimal. 25. An immunization exists for which of the following diseases? Hepatitis B virus, HBV. 26. Discomfort, redness, and swelling are all procedure consequences. 27. Whale microorganisms that cause disease called bacteria. 28. When should the discussion of discomfort and how to manage it take place? In the consultation. 29. Which of the following is a vascular condition? Rosacea. 30. Which of these is not an essential component of the client's consultation? Employment history. 31. Choosing a color for the eyebrows depends on skin tone, hair color, and the client's desire. 32. All of the following are requirements to minimize the spread of bacterial and burst infections except wearing booties. 35. The practitioner determines color course based on a client, skin color, and undertones. 36. The only scars that can be covered are pale and flat. 37. What is the first step before performing an eyeliner procedure on a client who is not wearing makeup? Take the client's picture. Begin the procedure. 38. The newest type of micropigmentation machines are the digital machines. 39. What information about chemicals used do manufacturers need to furnish? Material safety data sheets, MSDS. 40. Which muscle raises the lower lip and makes it protrude? Levator labii inferioris. 41. What process kills all microorganisms? Sterilization. 42. What is the purpose of an exposure control plan? To protect the practitioner. Dot. Which does not describe procedure side effects. Unpredictable. 44. What should a practitioner do prior to putting on clean gloves? Perform a complete hand washing. 45. What occurs when normal elastic skin is replaced with fibrous inelastic skin? Contracture. 46. Which pigment may react with magnetic resonance imaging, MRI? Iron oxide. 47. Which colors are not correctly paired to achieve color balance? Violet and orange. 48. Which of the following are examples of procedure side effects? Nausea and vomiting. 49. What is the document required by the OSHA bloodborne pathogens, BBP, standard that is facility specific called? Exposure control pan. 50. In Virginia, providing tattooing services without receiving compensation or reward or obligation is called gratuitous. 53. What is not consequence of a procedure? Rash. 54. According to Virginia regulations, what is the minimum age required to receive a tattoo unless accompanied by a parent or guardian? 1855. Some contraindications to micropigmentation include pregnancy, diabetes, and skin diseases. 56. Which of the following describes the result of hepatitis? Inflammation of the liver. 57. Which of the following is caused by exposure to a virus? Shingles. 58. When filling in a large area of solid color, the proper motion of the machine would be a circular motion. 59. Another term for paramedical permanent makeup is camouflage tattooing. 60. Which would best describe a granuloma? Small nodule, hard, and encapsulated. 61. Why Pecule the technician mix two primary colors for client application? To create a secondary color. 62. A non-pathogenic organism is harmless. 63. What does the Fitzpatrick scale classify? Skin types. 64. Which of the following is discussed during the consultation? Procedure, cost, and color. 65. Which of the following may form in response to the implantation of the pigment? Impetigo. 66. Potential mistakes during a procedure can be minimized by standardizing the treatment room. 67. What is the definition of consultation? Conversation with a client about the procedure. 70. A skin disorder that is completely or partially devoid of pigment is vitiligo. 71. What is often overlooked during the client's consultation? Photographs taken on the first visit. 72. What is dyschromia? Discoloration of the skin. 72. During a consultation, why is it important to determine a client's skin undertone? It could affect the level of discomfort a client experiences. It could affect the appearance of pigments on the skin. 74. A repetitive pressure on the median nerve can result in carpal tunnel syndrome. 75. What disease-causing agent is responsible for acne? Bacteria. 76. What is the recommendation for a client receiving a lip procedure who has a history of herpes simplex 1? To be pre-treated with an antiviral. 77. The muscle for children is called masseter. 78. What is the for tattooing apprenticeship programs in Virginia? 1500. 79. According to Virginia regulations, 3 years of work experience within the PRECT 5 years as a tattooer is 1. What all tattooing license applicants must submit to get their tattooing license. What a tattooing license applicant must submit to get their tattooing license than the required out-of-state hours of tattooing training were completed. 80. What is the definition of a contraindication? A condition for which a procedure is not appropriate. 81. What determines good shading? Amount of space it covers. 82. A client with scarring from a first-degree burn is not a good candidate for cosmetic tattooing. 83. What is the proper action if a client arrives with visible undiagnosed blisters? Inform the client they are not a candidate for the procedure. 86. Glands that lubricate the eyelids are called meibomian. 87. Individuals who are seeking an eyeliner procedure should have someone to drive them home. 88. Contaminated needles are disposed of in a sharps container. 89. All pigments change hue as they fade, exhibiting less of their base color. 90. What is the type of scar that results in excessive tissue growth called keloid? 91. Which type of micropigmentation equipment is the most commonly used today? Rotary pen. 92. The form that includes legal protection, disclosure of allergies, risks, and complications is client consent. 93. What are two techniques used during a procedure? Lining and shading. 94. Which of the following will not protect from cross-contamination? Recapping needles. 35. In Virginia, all steam sanitizers must be biological spore tested at least monthly. 96. 3 personal protective equipment components that a practitioner must use: mask, gloves, and eyewear. 87. The stratum corneum is also known as the HOMI layer. 98. A fluid that carries electrolytes, nourishment, and hormones is blood. 100. Which of the following must a tattoo license applicant forward a copy of to the Virginia Board to Barbers and Cosmetology, within 10 days of the event happening? A certified copy of a no-content plea from a case involving a felony or misdemeanor relating to tattooing, after all appeal rights have expired. 104. If a tattoo in Virginia fails to renew his or license within 30 days following the expiration date, then the tour must apply for reinstatement. 105. What type of machine uses rubber bands to hold needles in place? Coil machine. 106. Lip procedures are commonly done to enhance 2. Symmetric, thin lips. 107. Which type of pigment comprises the majority of the color palette? Inorganic. 108. Horizontal analysis of the face divides it into how many sections? 3. 109. Which of the following is not one of HTE strategies used by OSHA in the Bloodborne Pathogens (BBP) standard? Ergonomic design. 110. What type of condition is herpes simplex? Viral. 111. What guideline in infection control assumes that blood and other fluids may be contaminated? Universal precautions. 112. What color is opposite of red on the color wheel? Green. 113. All of the following are a one-time use supply except the pigment cup holder. 114. Micropigmentation can be performed on which of the following? Vitiligo. 115. An ice compress is not always the most effective method of anesthetic because it has to be continually applied. 116. When using equipment, practitioners must adhere to the manufacturer's directions. 117. Which muscle begins over the masseter and passes horizontally forward to insert into the angle of the mouth? Zygomaticus. 116. Purplish dots appearing a day or two after a procedure are a result of bruising.